How could you as a patient know the link between dietary patterns and health outcomes when your primary care physician doesn't know about nutrition?
Today we are walking and talking about walking and could be real good for health. Hey, welcome to Nourishable. I'm Dr. Lara.
I'm not Dr. Sam.
And this is Nutrition News Now. Sam, what has been going on in the nutrition news this week?
Some very big stuff, actually. So, if you missed it, a few weeks ago, my close personal friend Joe Biden rolled out a $8 billion nutrition plan to help make healthier food options more widely available to the public. This included like Instacart and DoorDash being more available to more locations, as well as developing an app. Well, they have doubled down on the nutrition thing, and the administration has granted $50 million to schools nationwide to help fund healthier options for foods and to help diversify school lunches. And this includes things like implementing scratch cooking, storing fresh foods, improving food safety. As far as some testimonials go, schools in North Carolina were able to provide better preparation and more visually appealing meals for their students. Public school in Michigan was able to harvest local produce with like steamers. So this resonated with me because growing up, I don't think I've ever had a school lunch where I ate it and like felt fine afterwards. You know what I mean?
What kind of not fine did you feel?
I felt like I would eat the school lunch. It would like sit there the rest of the day, and then I would be like expected to like run around, play on the playground, that kind of thing, all while it's all just like sitting there hurting my stomach.
Do you remember what kind of typical meals would be part of your school lunches?
They were like knockoff, great value versions of foods that seemingly don't exist. Like, they had like this Hot Pocket thing where it wasn't a Hot Pocket. It was like they took everything that is like good about a Hot Pocket, took that all out and left it cold.
No.
There was our lunch.
Cold pockets.
Cold pockets. The curly fries were subpar. The chicken was rubbery. We'd drink drink chocolate milk at like 10 a.m. It's like, how am I supposed to continue my day after having all this sitting there? So I just want to know, like, what did your school lunches look like? Did you kind of notice the same thing? Is anything I'm saying resonating with you?
Yeah, no, it definitely is. So to your first question, my school lunches, so I grew up in Canada, and the school that I went to, you brought your own lunch, or you went home for lunch. And so I grew up living very close to school, so I went home for lunch every day, which was, I guess, pretty radically different from the experience you had. And I think it's also radically different from the experience of a lot of kids here in the U.S. So that was my experience.
Yeah, we had the option to bring food from home, but it was like we did not get to go home for lunch. That was like not an option at all unless you're in college and you live nearby. But like it was always they provided the lunches. They were never really good. We had the option, and like that was about it. So I guess from an outsider experience, what is your observation of like the United States health, like nutrition awareness kind of looked like as compared to what it was like
in Canada?
Growing up? Yeah.
I don't really. I guess it's hard to really remember what it was like as a kid in Canada.
That is fair.
Yeah, but I think that's the thing that is resonating with me about this this funding that's going to be going into National School Lunch Program and helping make these school lunches healthier, more sustainable, more like local, is that just a reminder of it's so important for kids' nutrition. Where school lunches tend to be such a big part of their nutrition, and we really found that during the pandemic when all of a sudden so many kids weren't getting that reliable source of lunch every day. And then also just the fact that during childhood, that's a really important time when kids are developing their taste preferences and kind of getting exposure to healthy food. So we can, this money sounds like it's something that can be really harnessing that opportunity in teaching kids about healthy nutrition and exposing them to healthy foods.
Absolutely, because this is a recent development, this grant, but this issue has existed at least as long as I've been alive. This has been talked about, complained about for decades now. It's just consistently a problem throughout modern history, as far as I can tell, or at least as far as it feels. And it's kind of bizarre because there is a lot of emphasis and a lot of importance placed on nutrition, especially at that age, but it seems like there's a disparity between that teaching and the actual doing, the actual like funding of it. Where have you kind of noticed, or I guess where do you feel like that disparity kind of is, or where it would lie?
Well, I think funding is always a big part of it. So one challenge historically is that often the National School Lunch Program has relied on certain subsidies for particular foods. So all of a sudden, like a school will get 200 cans of canned green beans because they were, there was a subsidy for them. And so all of a sudden they're like, okay, we need to figure out something to do with these green beans that the kids will eat. And then another big challenge just has often been not enough funding for cooks and chefs to help to actually prepare these meals within the school lunches. And that's why you end up sometimes with these, really just, heat up this food and give it to the kids sort of situation. I know historically in the National School Lunch Program too, there have been like requirements for like there have to be this certain nutrient density, and sometimes there would be, they have to serve this many number of servings of vegetables. And so sometimes you'll fall into these debates of, does pizza count as a vegetable? And like, is there enough vegetable on pizza to say like, this is a vegetable? So you fall into some really kind of tricky areas there where they're like trying to follow rules, but ultimately it still wouldn't really, in my books, qualify as a healthy meal.
Yeah, absolutely. There's just, because what I think all of that speaks to is just a general lack of understanding. Because this actually ties beautifully into the second part, which I think kind of sums up the basic problem here. It's not a news story, but rather it was an opinion piece that kind of caught my eye. Basically, the opinion that's being developed and I guess argued here is that physicians are not being taught nutrition well enough. Or more specifically, CME or continuing medical education is not required in most states for nutrition, which I think is absolutely insane. Am I wrong?
You are not wrong at all. I agree 10,000% with you.
Okay.
And I know that this is also something that was really emphasized within that big White House conference on hunger and nutrition that just occurred, where your buddy Joe Biden, was suggesting.
Yeah, he told me all about it. Apparently it was a fun time. I wish I was there.
And so I know that increasing education for physicians in nutrition is a big part of the proposal there. And I think that it's a critically important area because nutrition has so much power as preventative medicine. And so it both preventative medicine as well as treatment to an extent, within a toolkit. But often nobody talks about nutrition with a patient or an individual until you're already have a disease. So, if we look at increasing the nutrition education of physicians, and I think in particular family physicians who have that long-term relationship with patients, that could be a really amazing opportunity to encourage, to make sure that that patients have a foundation in healthy nutrition and that physicians can highlight, okay, here are some areas we could work on. So I think that those are really important areas.
Yeah, because that was one of the things that the article touched upon. Was a lot of it has to do with like chronic disease, and that is not really talked about until that kind of enters the fold. And at the risk of sounding like a lazy school report, I would like to kind of list off some of the stats that the article listed. So apparently, this is all taken from various studies and everything. We have the link to this article in the description to read for yourself. But half of physicians, certified physicians, do not receive any nutrition CME, and 67% read about nutrition less than once every 3 months. Another study found that 94% of physicians feel that nutrition counseling should be a part of primary care visits, but only 14% of those feel adequately trained to offer it. And on top of that, again, most states don't require nutrition CME. So it got me thinking, you're a nutrition specialist. You have a PhD in it and everything, a big fancy degree. So I guess looking back on your studies, not necessarily the nutrition intensive stuff, but the more general courses, and for people you knew that were getting their PhDs and things other than nutrition, what did nutrition education look like? Was it adequate? Did you feel it was adequate, or did you feel that it was lacking in areas?
Well, I guess so. The first nutrition education I had was once I was in graduate school.
Okay.
I actually never took a full nutrition course like when I was in undergrad. But in looking at what I think would be great for physicians would be really focusing on what are the relationships between dietary intake, dietary patterns, and chronic diseases. Because I think that would really help physicians be able to identify some areas where they could help counsel their patients in how to improve. And they can be more simple things. Like, we don't need to get like super specific, but it could be things like getting an assessment of how many servings of fruits and vegetables do they tend to eat, or what is the diversity of fruits and vegetables, or generally what are their sources of dietary fiber. And those can be some really important factors that can be at least assessed for within a visit, and also then worked on in the future. And there's all sorts of tools out there that can help with tracking, both for motivation as well as just getting a sense of like, where are you right now?
Absolutely. And I think my last question I want to ask for this is, where do you think there seems to be a disparity between the need for better nutrition knowledge in the public and the actual education that's going on there? Where do you think that disparity is?
Yeah, there's definitely a huge need for more nutrition education. I feel like, and it's something that can start all the way back in kindergarten and kind of work all its way through, and it could include school lunches as well as courses with, touching on some of these topics within school curriculums.
Yeah, I mean, because for me, the health and nutrition was something that was like kind of taught in science class throughout my life, and then kind of brushed off for like all the molecular level stuff.
Right.
It's not something that I felt was super proper.
Yeah, no, and I think there could be also ways of making nutrition education very practical too. Like, I know over the years, kind of home economics types of courses have kind of become less popular because it was always previously was viewed as like, oh, this is just something that only the female students need to take. And then they're like, no, females can do more than just be a housewife, and, which is great. Yes, I support that.
Yeah, absolutely.
But I also think that everybody, no matter your gender, need to have the kind of basic fundamental skills to know how to prepare healthy meals. And so I think kind of bringing up a rise of home economics that bridges, cooking that bridges in nutrition science as well, could be a really amazing tool that is just part of school curriculum, so that as you become an adult, the first time that you move away from home, that you have those fundamental skills for grocery shopping, for cooking, so that you can be independently initiating your own healthy lifestyle.
Yeah, absolutely. I mean, when I was in college, my roommate kind of did all the cooking, so I never really got the chance to. But I wish I got this in school, because or at least in some sort of course. For me, I wish better health, better living was some sort of required course. Like, there is a health class in high school, but for me, it was mostly a sex ed class. There was next to nothing about how to actually treat your body with care.
Yeah, that was very much what it was in Canada as well. It's like health was mostly just sex ed, which is important.
It is
very
important. Yeah.
But there's more to health.
Yeah, exactly.
Yeah.
Yeah, like, there's health here, not necessarily further south.
There's health all the way.
Yeah, exactly. Your body is a temple, not just the waist. So with that, that's everything I have. That's everything I wanted to share.
So fascinating.
Yeah.
Well,
Thank
I
you.
have a question for you, which is, how many steps a day do you need to take to be healthy? Do you know? Is there like a number that like you've maybe heard before or feels right?
Well, when I worked as a fulfillment associate at my local Lowe's Home Improvement, I took I think my average steps per day was around like 10 to 15,000.
Okay, that's a
Something like
15,000. That is a lot. Wow.
Yeah, I was on my feet like all day.
All day. Wow.
So I'm assuming that's good.
That is fantastic.
Okay, thank God. Okay.
Yes.
Okay, good.
So often there's this word of 10,000 steps a day that gets thrown around as being like, this is the magic number of steps a day to be healthy. Turns out that number was never a number that was determined based on research. It was just a number that was part of a marketing campaign from I think it was a Japanese step counter like device from like the 80s or 90s. So that 10,000 steps a day number, never scientifically based. However, there was a new study that came out this week that was looking at the association between number of steps per day and risk of chronic diseases. So now we're starting to find what is the relationship between how many steps you take and things we care about, things like diabetes and obesity and depression, mental health. So that's really exciting. One of the reasons I wanted to talk about this study today with you is because there have also been some big popular media reports about it. And while the study was great, these headlines did kind of, in my opinion, blow it a bit out of proportion.
Okay.
So let me read you one of the headlines here.
I was just about to ask.
Yes.
If you have some plans.
New research finds 8,600 steps a day is the perfect amount to keep weight off.
Aha.
So what is your reaction to a headline like that?
So when I see that, I mean, I'm kind of a cynic, so I see that and I'm like, yeah, right. What's the actual number? Like, that sounds like almost too good to be true. Like, it's actually less than you thought it was. Like, that's where my brain goes.
Okay, really interesting. Yeah. I think my takeaway from it is that it sounds like if you take 8,600 steps a day, you will, this causes you to not have obesity. Like, it sounds like a very causational statement. It will prevent obesity.
Yeah.
It absolutely will not happen. You will not gain weight if you take 8,600 steps a day. If you take only 7,000 steps, 7,000 steps a day,
Yeah, better luck next time, loser.
yeah, exactly.
Yeah.
So that's kind of, I looked at that statement and was like, wow, that's a really strong causational statement.
Yeah.
Which, when we actually look at the study, which was a phenomenal study, the way the study was designed, they can't actually make a causational statement. They can make associations. And so, which are really important, but we can't make a causational statement like that.
Yeah, because it also feels to me that, like, certain people would need, like, different people would need a different amount of steps per day, just because, like, everybody's body works, like, slightly differently. So deciding on a perfect amount almost seems, like, impossible. Am I?
Oh, definitely. And I think
it.
what you're getting at is that we all of our bodies are a little bit different. We have kind of a diversity of factors that are all kind of in a stew of like what makes our health. So, I mean, the idea that there's like an exact perfect number, yeah, it should set off your spidey sense, and I'm glad that it did.
Yeah.
But so this study was a really fantastic study. It was by a team of researchers at Vanderbilt University, and what they did is they were working with a cohort of people that are part of the All of Us study, which is a big study of about 1 million people in the United States. You can volunteer to be a part of it, and they collect all sorts of different information. For this particular study, what they were doing was some of the participants said, hey, I wear a Fitbit. Here's access to my Fitbit data. And then the researchers also had access to their electronic healthcare records. And so what they could do is they could look at years worth of Fitbit data, so years worth of how many steps a day they got, and over time look to see if these participants developed any diseases. And so when they did that, what they found was that there was an association between more steps per day and lower risk of developing obesity, of developing hypertension or high blood pressure, and developing depression, which I thought was really, really interesting. So have you ever worn a Fitbit or any of these kind of fitness trackers before?
I never have. The closest I have is the little health app on my phone.
Oh, okay. And even just with a health app, do you find that, like, do you pay attention to it? Do you feel like it motivates you? No?
Nah, it's just kind of there.
Yeah.
If I'm curious, I'll look at how many steps I took that day, but other than that, it doesn't even cross my mind most days.
Okay. Yeah, really interesting. I have used a Fitbit various fitness trackers a few times, and I find it kind of interesting to see how many steps I take generally, but I also don't find it to be the most useful thing. Just the step count.
Yeah, because those feel more like trivial facts about you than they do actual like health trackers.
Right. And I think that there can be a benefit to them if you're trying to motivate yourself. Like if you're somebody who didn't have a lot of movement, but you're trying to challenge yourself to get more, I can see how they can be a really powerful tool for that.
Yeah, absolutely.
So what I found so interesting was were these associations between more steps and reduced risk of some of these conditions. And they did find when they looked at, okay, how many steps per day is it once you start to get to that reduced risk? It did look like it was somewhere between like 8,000 to 9,000 steps a day when we're looking at a reduced risk of developing obesity, a reduced risk of depression.
And I'm assuming that's where the 8,600 number came from.
That exactly.
Which is an arbitrarily decided number right in the middle.
Right, and so what they did, when you read the research paper itself, they never say, magic number 8,600, but they do show some graphs where you see, right around there is where you cross into the reduced risk territory. So something else that I thought was interesting in the study is they found that people who started off at the beginning of the study in an overweight category, that if they took more steps per day, and again, kind of around that 8,000 and up number, that then they had a reduced risk of developing obesity. So kind of transitioning from being categorized as overweight to categorized as obese according to the body mass index. So I thought that was kind of interesting as well, that it helps kind of buffer that weight gain, that like slow weight gain over time that is just really common in adults.
Absolutely.
So what I was wondering from you is, I know we've talked before a lot about how within your generation, how mental health is a big focus. Mm-hmm. So I thought this finding of an association between more steps and reduced risk of depression was really interesting. And how do you feel like a message like that could be kind of packaged towards your generation that with such a focus on mental health?
So the best way to go about that is to just observe what the zeitgeist is and exploit it to that benefit somehow. And for me, everybody, or the general feeling, the zeitgeist in my generation, a little older, a little younger, is a general sense of like nihilism and like everything is ironic. Everything is ironically done. Everything is done for the laughs and they know it's dumb, but they do it anyway because like we live in the social media age. Everyone's doing everything for no reason all the time. They know it, but they do it anyway. So I feel like if you're going to market or if you're going to try to impart this kind of wisdom on them, you have to do it in a way where they don't notice. You have to do it in a way that like on the surface seems absolutely stupid, but ultimately like it actually gets the point across. You know what I mean?
Okay.
It's like a weird undercover marketing tactic where you have to market without marketing. You know what I mean?
Yes.
Is marketing the right word?
I think so. Or promote.
Promotion,
that would be the same.
Like
promotion
general
would be the same thing.
area,
Yeah. Huh.
You have to do it, yeah. Because no one in my generation wants to be marketed to.
Right.
They want to feel like, because we live in the age where everything is open, everything is available, they want to feel like they're happening across something all on their own. And if they feel like they're having something shoved down their throat, they're just going to instantly reject it.
Okay. Huh. Yeah, because I think the things that I love about findings like this are that walking can be so impactful and it's free and it can be a way to be outside, which is also generally good for mental health. And
another thing actually that just came to mind, sorry to cut
yes,
you off,
please tell me.
but another thing that in the social media age, just instant, like, aesthetically pleasing content, like, you're almost guaranteed to get some sort of click or view on it. So, like, if you emphasize the just natural beauty of going out for a walk, observing trees, I think that would also work.
Could it be a challenge? Like some kind of, I don't know, take a picture on your walk a day challenge? Or is that like...
That's kind of what Be Real is.
Okay.
Like,
okay.
Be Real, I think... It's actually funny you say that, because I feel like Be Real could be a platform to promote that. Because do you know what Be Real is?
I am sort of familiar, but tell me more about Be Real.
Well, for those unfamiliar, Be Real is this thing you get a notification once a day where you pull out your phone, wherever you are, no matter what, you take a picture of yourself and you take a picture of what's in front of you. So it's like you're being real. You are just showing people what's actually going on. So you could have like this great looking selfie and then you turn around, there's like, you're in your messy bedroom. So like, motivating people to go outside for their Be Reals and have like really interesting wild Be Reals and like the outdoors where you're like out, you're doing physical activity, that like subconsciously promotes physical activity. And I feel like that's a good way to implant that almost into people.
Let's start
through
it.
Something like that.
I guess Nourishable needs a Be Real account.
We need a sponsorship is what we need.
Yes.
Yeah.
Let's make it happen.
Email us. It'll be in the description.
But yeah, to me, the power of walking, I think it's amazing. I think it's exciting. And I think it's something that, every generation, every age group can benefit from.
Absolutely. I mean, I love walking, so I might as well just do it when I get home today.
Yeah.
You're kind of inspiring me, actually.
Oh, yay. I'm so excited.
Walk around block later. Okay, thank you.
Yes, well, thank you so much for joining me today, Sam.
Thank you very much for having me. It's always a pleasure.
And if you want to read the references that we talked about today, we included the links in the video description.
And if you have a story or if you're aware of one that you would want to hear us talk about, you want to hear us delve into a little bit, by all means, tell us in the comments, email us, find us on our social media, send the story there. We will look it over, we will talk about it.
That's what science tastes like.
And it doesn't taste like public school lunch.
Today we are talking about walking and walking about talking. No, that's not right.
I don't know how you do that, but we're gonna do it.